Acting Secretary earlier testimony today indicated that the department shares certain information with other governmental agencies. Can you speak specifically to whether or not the Department of Health shares information through your electronic death registration system with the Department of Human Services for benefits or the Department of State for voting purposes?
I'm not familiar with that. I'd have to get back to you on that answer.
Does any of your executive deputy secretary or any of the individuals here in the room, are they able to answer that question? Very good. We will follow up with you on that question. Acting Secretary, during the COVID-19 public health emergency, the Centers for Medicare and Medicaid, CMS, implemented a federal waiver program to allow Medicare beneficiaries the option to receive acute level health care services in their home environment where they can be supported by their family and friends. And this care delivery model has been shown to reduce costs, improve outcomes, and enhance the patient experience. So the federal government just extended that program for 2 years after the COVID public health emergency. And the federal program covers Medicare patients, but do you believe that the Department of Health could make it more conducive for health systems to also provide that same level of care to patients with insurance from other payers, commercial, Medicare Advantage, Medicaid?
I know you and I spoke about that program. I did read about it a little bit after our meeting. I'm not sure in terms of coverage whether that is, again, if it's an insurance question or a coverage for Medicaid, that is not what the Department of Health has any control over. In terms of, so is that what you're asking me in terms of the financial or?
Well, could the Department of Health work with health systems so that same acute level of care could be provided to patients who are on other types of insurance products, Medicaid, commercial? Are you willing to work to see that accomplished?
I have to look into the regulatory requirements and the legal requirements on that. But again, it's a model that looks promising and interesting. I understand it's pretty limited in scope of who and what it can be done. So again, I'm happy to work with our hospital quality assurance program and review our regulatory issues to look at that issue. Again, happy to talk to you about that more.
I would appreciate that. And I think patients and taxpayers also would appreciate that. So thank you. I appreciate the response.